Is beetroot juice actually good for erectile dysfunction? That's what we're looking at today because it's been popping up everywhere and it's worth separating the science from the hype. ED is incredibly common. Research suggests it affects up to half of men between the ages of 40 and 70, and it can have a real impact on quality of life, relationships, and mental well-being. So it makes sense that people are looking at every possible option, including what's in their fridge. Here's the biological idea behind beetroot juice. Beetroot is naturally high in dietary nitrates. When you consume them, your body converts those nitrates into nitric oxide. And nitric oxide is genuinely important. It helps relax and widen blood vessels, which is a key part of how erections work. When you're sexually aroused, your body releases chemical messengers that relax the smooth muscle in the penile arteries, allowing blood to flow in and create an erection. Nitric oxide plays a central role in that process. So the theory is plausible. The problem is the evidence. Right now, there are no large-scale clinical trials that have specifically tested beetroot juice as a treatment for erectile dysfunction. What we do have is cardiovascular research showing that beetroot juice can lower blood pressure and improve blood flow more generally. That's promising, and it suggests there could be indirect benefits for ED that's rooted in vascular problems. But we can't say for certain based on current evidence. It's also worth understanding what's actually causing your ED because it isn't always vascular. Causes can include neurological conditions, hormonal imbalances, psychological factors like anxiety or depression, lifestyle factors such as smoking or alcohol, and certain medications, including some antidepressants and antihypertensives. If you're thinking about incorporating beetroot juice as part of a healthy lifestyle, that's a reasonable conversation to have with your doctor. It's generally considered safe for most people in food amounts, but if you're already taking medication for blood pressure, adding something that also lowers blood pressure needs to be discussed with a healthcare professional first. And if you're on nitrate-based heart medications, this is particularly important. Speak to your doctor before making any changes. On that note, if you're experiencing persistent erectile difficulties, please do see your GP. ED can sometimes be an early sign of cardiovascular disease, which means it genuinely warrants a proper medical assessment, not just a dietary tweak. NICE guidelines recommend PDE5 inhibitors, medicines like sildenafil chau, as the first-line pharmacological treatment for ED, and there's strong clinical evidence behind them. Your doctor can talk you through what's appropriate for your situation. And one important safety point, never combine any ED medication with nitrate-based medicines. That combination can cause a dangerous drop in blood pressure. If you ever experience chest pain, sudden dizziness, or feel faint, seek medical help straight away. So to recap, beetroot juice contains nitrates that convert to nitric oxide, which does play a role in erectile function, so the biology makes sense. But there's currently no direct clinical evidence proving it treats ED. This video is general information only, so please speak to a healthcare professional for advice tailored to you. And if you're dealing with persistent symptoms, seeing your GP is the right first step. If you found this helpful, leave a comment below. We'd love to know what topics you'd like us to cover next. And if you haven't already, give this video a like and subscribe to the Bolt Pharmacy channel for more evidence-based health content.